Thank you very much for inviting me to come and speak today. I just wanted to tell you a little bit about me. I'm a health psychologist and I work here at the Royal Free Hospital. I've been here for about 7 years now. And before that, I worked for about 3 years at another large London teaching hospital, which is Guy's and St Thomas's. And then before that, I worked for about 12 years in academic research in health psychology and in psychiatric research as well. As a practitioner, health psychologist, I have an interest in working with individuals who have chronic illnesses, and by chronic I mean long-term conditions. And here at the Royal Free and also at Guy's, I work with people who have kidney failure or kidney disease. So either their kidneys are failing or their kidneys have failed, and they're having quite invasive treatment called dialysis treatment, which cleans their blood. And they have that treatment either every night, every day for 8 hours in the evening, or they'll go to a dialysis unit where they'll have dialysis treatment every other day for 4 hours a day, so that's 3 times a week. So I work with individuals who, because of their long-term condition, because of their chronic ill health, they may have some psychological difficulties, and as you mentioned, depression or possibly anxiety, and other conditions as well. So yes, I'm not an expert in PSC. I work with here as well. I also see liver patients, and predominantly we see patients who are about to be transplanted. So we will see patients who do have PSC as well as other liver conditions. Okay. So as you probably already have guessed, this talk today involves talking about emotions, and I was a little bit nervous when Doug asked me to come and speak, and also when I spoke to Martine, who mentioned that you've had meetings like this before and nobody's spoken about the emotional impact. So that's what we're going to do today. So here goes. So I want to start by looking at chronic illness and your emotions, and in particular, what sort of emotions can be generated by having a long-term condition. I then want to look at PSC in particular, and how that might compare to other general long-term conditions. What components and what sort of emotions are in common. And then I want to very briefly look at ways that people use to adjust to chronic illness. Okay, so throughout this, you may be familiar with some of the things I say today. I want to start by saying that most people cope perfectly well without any formal psychological support. Okay, and that may well be the case for many of you. I know you're not all based here in London, but we're very fortunate to have psychological support for some of the liver patients here. I don't know what sort of psychological support you may have where you're from in terms of your trust in your hospitals. But I am aware that some specialties are way ahead of the game when it comes to psychological support. For example, oncology, they've been doing this for years and years, and in fact they've been doing lots of things for years and years, but psychological support is certainly something they've been doing. Us in renal, we are trying to chase up and catch up, and hopefully in liver, this is something that through research we will start looking at the unmet need, the unmet psychological need of individuals with liver conditions. So I just want to start with a quick 10-second exercise. What I'd like to do is just to reflect on these 2 questions. Firstly, how might someone feel when they're first diagnosed with a long-term condition? How did you feel? Oh, okay. Please do if you want to.
I was bewildered and I didn't know else brave enough to share that? Yeah.
Likewise, didn't know anything. Oh, you've got PSC. And at the end of the day, on the ward, empty ward, squeezing you on a little liver.
Yeah.
We'll see you again in a few weeks' time.
Yeah.
Absolutely. Very common.
Trying to remember what PSC actually stood for.
Absolutely, and work out what it means. And yeah. Was there another hand? Yeah.
It's extremely anxious.
Yeah. Absolutely. I can imagine. Indeed. Yeah.
I was very confused because I was diagnosed pre-internet.
Right.
So I feel nothing.
Probably a good thing, actually. I'm not sure.
British Library here, papers helped.
Yeah. You found some, which is good. Okay. So all very common emotions, really. The second question is, what impact does chronic illness have on an individual's life? And thinking again about your own life, what impact has it had on your own life? And again, you don't need to, you can. Yeah.
Just have extra things to think about. So do I have this with me? Do I have that with me? If this happens, what do I do about it? Can I do that where I'm going?
Yes,
You
absolutely.
have to think about this kind of thing.
Absolutely, things you probably wouldn't think about ordinarily before that. And these questions are not just for those who have the condition, but also for relatives, partners, friends who might be here as well. Because long-term conditions don't just affect the individual, they affect everybody who is in their life as well, or can do. Sorry, I've been told by my children to keep to your script because I do digress a lot. Okay, so as you can see here, there are a number of areas of different parts of people's lives that can be affected. And this can actually happen directly by the condition itself, or it can happen indirectly by the way in which one area may sort of cascade onto another area. So, for example, an obvious example maybe if the illness might affect someone's ability to work or work in quite the same way they had been working before, then this may well impact on finances, which then is likely to impact on, I don't know, perhaps leisure activities and not being able to go on holiday in quite the same way, which then may impact on family relationships and partnerships. And so, as you can see, there's quite a number of areas that can well be impacted, and people here may recognise some of those already. So, what are some of the challenges of having to live with a long-term condition? We've just looked at the areas of life that might be affected, but what sort of things does it actually entail? What's the JD? What's the job description? Here you go, you've got this chronic illness. Now what? What do I do with it? What does it involve me having to do? Well, there are the clinical aspects to start off with. Things like attending hospital appointments. I know that might sound quite simple, but for many people before they were diagnosed with their condition, they may not have ever entered a hospital as a patient. And just the practicalities that are involved in attending hospital appointments, simple things, daily hassles, finding somewhere to park, reorganising your life, reorganising work and everything else. Okay. Taking medication, that's quite common for many illnesses. Again, people may not have had to take any tablets before that. You have to start remembering when to take them, organising, getting prescriptions, making sure you don't run out of the medicines, particularly if you've had a transplant. It's crucial that you take these medicines as prescribed and that you're adherent with them. So again, this is just something else you may have to think about. Managing symptoms such as pain, fatigue. Fatigue is common in many long-term conditions, and I know we've just spoken about it here already, that it's one that's very common in PSC as well. And itch is something that renal patients, particularly in the last stages of their kidney function, they can become very itchy as well, and that's a very common symptom. And the difficulty as well with managing symptoms, sometimes the symptoms can be quite unpredictable, or they can be quite sporadic, and sometimes they can trick the person into thinking that they're better because they may just go away and they may be asymptomatic. They may trick not only the person who has the condition, but also family members. So one day they might be really tired, and then other days they may not be. And so the expectation for them to do things differently might be there on them. Another thing about when symptoms can be variable in this way, particularly with fatigue, is quite often we see what we call boom and bust. So people will try to do lots and lots of things when they're feeling better, because they don't know when they're not going to, they might feel unwell, and then when they start to feel unwell, they may do nothing or very little. So their activity levels sort of fluctuate like this as well as their mood at the same time. There's also managing other comorbidities, other illnesses, other conditions. Again, I'm going to reference back to renal patients. Not only do they have the kidney failure, sometimes because they have the kidney failure, it's because they've had diabetes or because they've had sickle cell disease. So these are other conditions as well that they have to think about, they have to manage. These might involve having to take medicines as well, but they will certainly involve having to see different specialists. And I'm very aware with PSC, there are other common conditions such as inflammatory bowel condition and also bacterial cholangitis, which is the bile duct infection as well. So there's also this to think about. Coping with hospital admissions, procedures, possibly biopsies, being tested. Is one thing going to the hospital, but quite another having to be admitted to hospital. Again, thinking about what's also going on outside of your life, having to reorganise children, life, etc. Learning about the condition. This might be, as this gentleman here mentioned, his learning was at the library. And you get to that says learning about the condition, I meant learning. And particularly if the condition's quite rare, you eventually become the expert patient, and you're involved in the frustrations of when you leave the confines of the hospital, who know you and know the condition really well, to maybe going to your GP who's a generalist, who doesn't really know anything about, or much, I don't know how much GPs know, but there's that frustration as well. Is this making sense to people? Yeah, good. I've got fluid and dietary control, only because I'm referring again to renal, and this gentleman here mentioned there's a possibility of changing the way in which you eat and the timing of your eating. Certainly in renal, patients are restricted once they're on dialysis to something like this. This is their daily fluid intake, which includes everything: the water you take, the fluid you take, you use to take your medicines with, ice cream, soups, anything for the entire day. It could be something like half a litre. So there are certainly demands and challenges placed upon people. And of course there are the socioeconomic, potentially the socioeconomic demands of having to change perhaps your working style and organising activities around hospital, etc. Now I come to the emotional challenges. Patients often talk about good and bad days. Okay, you may recognise some of these emotions: denial, anger, frustration, sadness. The reason why I'm talking about them again today is because I just want to normalise them. I just want to help people to recognise that these are normal emotions to go through and to have. And quite often people can feel very isolated. It's just me. I'm the only one who feels this way, and I'm the only one going through this. So people may feel any number of these emotions throughout their journey, or even on the same day. Again, it's all very normal. Coping with other people's reactions, which I've often heard can be, I know can be quite difficult. in health psychology, we have an understanding that all conditions have a lay person's perspective about the condition. So everybody's got their idea about what caused the condition, how long the timeline, how long that condition might last, and the consequences of that condition. And well-meaning people might try and give advice about, oh, I know how you got that, and oh, I know what you should do for that. And so it might then, it might have an impact on who you decide to tell about the condition. Also, there might be some stigma attached to the particular long-term condition. For example, people mentioning liver disease, automatically those who don't know might think about alcohol, and nothing to do with alcohol. But you then, again, you make a decision about who you tell, because you may be concerned about how it might appear to them. Sympathy, many long-term conditions, they're quite hidden. You don't necessarily know somebody has it. Certainly with renal patients, you don't know to look at them that they're dialysing 3 times a week. So they may not elicit the same sort of, we don't want sympathy really, we want empathy. We want people to have an understanding of what you have to go through. Nobody wants sympathy really, they don't want to be sympathised with, but they certainly want an understanding. And then again, who do you tell? Family, friends, how do I tell children? So all of these things, these are all the challenges that people have to really consider. Guilt is something else that I commonly see. People can sometimes feel quite a burden on family members. They may feel that they're not the same person they used to be, or they feel like it's almost as though they've had a change of personality. Guilt is something I also see with patients who are about to undergo liver transplant. They sometimes feel quite guilty that somebody has to die in order for them to have a transplant. So again, all common emotions. Uncertainty about the future in all long-term conditions, but particularly PSC, where there are lots of unknown questions, or the answers we don't know the answers to. What are the long-term implications? Sometimes people can feel unable to make long-term plans as well because of this uncertainty. Some of you may have heard of the Swiss psychiatrist Elisabeth Kübler-Ross. She, on her work with patients who were terminally ill, formulated 5 stages of grief here. So it's called the grief cycle. And basically her work now has been used much more widely, not just with death and dying, but in terms of trying to understand how people feel as they travel from hearing about the change or the grief or the trauma right until the point where they start to accept it, which sometimes it isn't ever. And as you can see here, she starts with denial, which in fact is quite a natural and quite a normal defense mechanism to protect oneself, so that you can process any information in your own time. So you may sort of just switch off when you first find out, and so that you can just cope with life. You can just get on with life and not have to think, you might park it and put it in a space so that you can retrieve it whenever you feel you need to. So denial is functional and can be good, but up until a point, of course. We can't keep denial going forever. And then Kübler-Ross talks about anger. This is the stage where people can feel quite frustrated, irritated, quite anxious. They might get angry with the system. They might get angry with the GP. I knew I felt unwell for ages. Why didn't they refer me? These are all normal reactions. And anger, and it's particularly important. Anger can be directed at, particularly at loved ones, those who are closest to us. So always worth bearing in mind what's really perhaps going on under the surface there. And then talks about depression, where there's some sort of realization of the enormity of the change. People can feel overwhelmed and quite helpless. And then they sort of get up to this bargaining stage. Not everybody goes through a bargaining stage where there is the sense of trying to find meaning in the struggle. So almost, well, if I get a transplant, then everything will be okay. Or if I get a transplant, then I'll never do this again. And then finally to acceptance, where an individual may accept, perhaps they'll accept the unpredictability, perhaps they'll accept the uncertainty of what the condition may lead to and the impact it might have. I mean, I know this seems like a very nice, fluid line where everybody starts at denial and they sort of mosey on down to depression, and it's not like that at all. People sort of jump around all the time. They might go from denial to bargaining to acceptance back to anger. So it's fully accepted that it's not as nicely and nice as fluid as that. So PSC, how does it compare? What sort of emotions are also experienced here? Okay, so I've sort of constructed this, what I call my emotional pathway, and I use this for other conditions as well. And it may or may not be accurate. I'm not a PSC expert. You guys are the experts. But what I'm trying to do is just trying to map out at different stages the sorts of feelings people might have. So I'll start off perhaps going to the GP. I don't know how everybody found out about their condition. There may have been GP who might have then sent you to a specialist, some type of specialist. That might have been a gastro person, gastroenterologist, or the GP may have sent you to the hepatology service. What's in red here, these are some of the emotions. These are some of the feelings people may have been experiencing at the time. Martine, I know you mentioned worry and relief. There might be relief, I knew there was something wrong, and the fact that you have some sort of acknowledgement to that might be a good thing. So I'm just going to put in all these other arrows here, okay, and they're just showing all the different types of emotions that could potentially, and even more, that people can have at any sort of stage. And here I've got this big sort of cloud of question mark, which is cloud of uncertainty, which certainly is something that PSC sufferers may experience of just not knowing. I've taken this, very kindly given permission by Martine. This is from the report. There's some research that's been done looking at the research and I think psychological needs of patients with PSC. And I've just lifted this table and put it in here. And these are the answers to the question, describe the most difficult part of living with PSC. And as you can see, 60% of respondents spoke about that uncertainty in one way or another. Recurrent PSC, that's after transplant as well. Sense of helplessness, and also general concern. So, what sort of psychological difficulties are commonly seen among people with chronic illness? Well, we've already touched on a few. Depends on the condition, obviously. And here we go. I could see probably individuals with any number of these in a month, really. Many of these conditions predate the actual diagnosis, and what can happen is the onset of the illness can exacerbate some of the existing symptoms. For example, somebody might already suffer with a depression, and the knowing about the long-term condition and having to manage it may exacerbate the symptoms of depression. Anxiety as well, just not knowing about what the prognosis of the condition. can then be generalised to lots of other areas of life as well. So there are a number of presentations that we commonly see. I did a quick literature search. I searched the academic literature for what's out there on mood and PSC, and I really couldn't find very much actually. I found 2 papers, and in fact I've just put those there really to show that not only is there not very much out there already known about this and written about depression and moods in PSC, but both of these papers that were written have conflicting results and conflicting findings, and what they were looking at was, well, the first paper was looking at the extent of depression, but also looking at fatigue, and whether fatigue was actually part of the depression or whether it was part of the illness, and the jury's out on that. They found conflicting results on that. So emotions in health, very quickly. So, you know, what's the big deal about emotions in health? Why do we talk about it? Well, we know that if emotional distress becomes too overwhelming and enduring, it can have some of these, it can impact in this way. It can actually impact healthy behaviours that we do to keep ourselves as well as possible. So it might reduce physical exercise, the quality of sleep and the quantity even of sleep. It might decrease adherence to medical treatments. You know, people just say, what's the point? I can't bother to take my medicines. Certainly with people on dialysis, you know, why show up for dialysis? So certainly emotional distress can impact on these behaviours. It can worsen the immune system and also change the way in which you think about your illness and the quality of your life. And here's an example. I'm also a cognitive behaviour therapist, CBT therapist. Some of you may have heard of that treatment. And what that does is help individuals to look at the way in which their thinking impacts on their feelings and their behaviours. And you know, not all thoughts are accurate. Not all thoughts are true. Just because we think something, it doesn't necessarily mean it is the case. However, sometimes when people are a bit low in mood or if they're very anxious, that thinking can be a bit skew-if, and it can impact on your feelings and your behaviour. So basically what this is saying is just to be mindful, just to be aware of how you're thinking and not necessarily just what you're thinking. So adjusting to long-term conditions, coping strategies. Let's get on that. So coping refers to the ability used by people to face problematic and stressful situations. This is what you're doing all the time. Different types of coping, problem-focused coping, just, you know, these are strategies that attempt to address the problem itself by physically doing something about it, doing exercise, seeking out information, this sort of thing. Emotion-focused coping, apparently this is something women do very well. Seeking out emotional support, talking to each other, meditation, distraction, that sort of thing. The downward comparison in terms of it could be worse. That also helps people to cope and to manage. And also I've got here some unhelpful strategies here, substance, I should say misuse of drugs and alcohol. Another way of adjusting to coping, good communication and information giving. As you probably already do this already. Good communication during consultations. Really important, you know, to take notes whenever you go to your consultations, to help with your memory, help you to remember what's being said. Do ask questions, don't be embarrassed about asking questions. Quite often medics can use terms that very easily, not realising that these words are specialist words, and not everybody will quite understand, and sometimes people can feel quite embarrassed and silly if they ask questions, because they, you know, obviously the doctor said it, so I should know. Well, not necessarily so. So it's important to ask questions. They may not know the answer, which can be reassuring sometimes and may not be others. Repeat back what you've heard, just to ensure you've understood, and also, if possible, if you can, take somebody along to your consultation, just as a support. These are the reasons why, these are the things that happen when there is good communication. And this is not just communication between patient and doctor, this is also individuals communicating their needs and feelings to others as well. Some people are better at talking about their feelings than others, but it's always good to communicate. Social support. We know that it helps adjustments and is a modifiable risk factor in a number of chronic illnesses. Basically what that means is it can sort of change the course of an illness sometimes, depending on the extent of social support you have. For example, if you have a 90-year-old gentleman with dementia living alone at home, obviously his outcomes will be better if he had somebody there supporting him, a supportive wife or partner or somebody who comes in. So, you know, the obvious reasons really can be practical or emotional, and these are some of the mechanisms by which social support can have good outcomes here. It can increase patients' perception, quality of life, increase access to healthcare. You know, just physically somebody taking you to your appointment if you can't manage to. And lastly, formal psychological support. About that. Okay, another aid to adjustment. Again, I stress that most people manage perfectly well without any formal psychological support. However, there may be times where people, depending on the stage of the journey, may need to speak to somebody, or they may even prefer to speak to somebody who's outside of their social support network. When to get help? Like I said, at any time of the journey really, but particularly seek help if you're finding it difficult to cope with thoughts and feelings. And again, this is not just for patients, this is for partners and other family members and friends too. Do seek help if your thoughts and feelings are having a negative impact on your day-to-day life. What do I mean by that? If you're not getting out of bed, not because you're fatigued from the condition, but because of what's going on in your mind. Or you're so anxious that you can't concentrate or that you can't focus on anything. Do seek help then. And also if your thoughts and feelings are stopping you from engaging in treatment at all. Again, if you're supposed to be doing things, a particular treatment that's supposed to be helping you, and what's going on in your mind and how you're feeling is preventing you from doing that, then obviously please do seek help. Having said that, I recognise that, you know, there's a paucity of psychological support in liver services, but if you do have a psychological service or a counselling service, then please do access that. GP is always a good place. They will refer you to your Improving Access, your IAPT team. The government has pumped lots of money into enabling people to access psychological services easily. So quite often these services are, you can refer yourself online. So do consider that. Mental health charities, timetochange.org is fantastic. Mind as well. Anxiety UK is also very good. In fact, I called them yesterday to find out whether they still existed. And they do, and they're quite good because they also have means tested. You have to pay a fee for the therapy, but it's means tested, anything from £15 to £50, and they do telephone sessions as well. So these are all great places to go, and private sector if that's something you're able to access. So I'm just leaving you with a photo that my brother sent me. It's a Venetian sunrise. He sent me that 2 days ago, 3 days after the supermoon. So I quite like that. He just took it on his iPhone, so I thought I'd leave you with that. Thank you.